I want to thank the organizers for the opportunity to join today and share some of the training efforts I've been fortunate to help coordinate. Now, as we all know, vestibular disorders affect millions of people worldwide, and yet training in vestibular medicine remains highly fragmented, and this is across disciplines, institutions, and countries. And so today I'd like to introduce you to two coordinated initiatives that aim to help change that. The first is the EU Marie Curie Doctoral Network PROVIDE, which I coordinate, and the second is the Bárány Society Vestibular Medicine Curriculum, which was developed by Raymond from the Berg and his colleagues. Unfortunately, Raymond couldn't be here at AR today, but I'm really happy to be able to present for him. Now, together these efforts reflect a shared goal, and that's to build a very globally connected and highly trained vestibular workforce, both in the clinical setting and also in the research setting. And so I'll briefly focus on three things: how structured international doctoral training can accelerate progress in vestibular research and care, also present to you a global curriculum that's improving access to high quality education in vestibular medicine, and also how you and your trainees can get involved. Now, first I'll introduce you to the PROVIDE Doctoral Network. PROVIDE stands for Patient-Centered Care for Vestibular Disorders, and it's a Marie Curie doctoral network designed to advance the understanding, diagnosis, and treatment of vestibular disorders through highly interdisciplinary training. The network brings together 22 partners. This is across 12 countries and spanning universities, medical centers, and even industry collaborators like Medell. And our goal is very simple, if not ambitious, and that's to train researchers who can move very smoothly between basic science, clinical practice, and also innovation. And we're currently training 10 doctoral candidates through a program that emphasizes international mobility, cross-sector experience, and collaborative research. And we presently have one open PhD position, so if you know an outstanding candidate who would be interested in this type of international training, please put them in contact with me. I'd next like to share with you efforts to develop a vestibular medicine curriculum. As we all know, despite this prevalence and clinical impact of vestibular disorders, formal training is really difficult to obtain. And I think that's in part because vestibular medicine sits at the intersection of a lot of different disciplines: neurology, otolaryngology, audiology, physiotherapy, neuroscience. And so it's not owned by any one specific discipline. And this fragmentation makes structured education even more essential. And so in response to this need, Raymond van den Berg and the Bárány Society Training Committee launched a very ambitious initiative, Free Vestibular Medicine Education Worldwide. And the goal is to create an accessible and also comprehensive curriculum that integrates both basic knowledge, clinical practice, and even some of the most latest emerging research. And so while it's initially been developed for healthcare professionals, the curriculum is equally valuable for scientists and other trainees who really want one place where they can see a consolidated presentation of the vestibular system from basic mechanism to disease pathology. And so PROVIDE is really proud to be able to partner in supporting and expanding this educational effort, because we realize again that advancing vestibular care really begins with better training. So this curriculum is already available online and hosted by the University of Utah. What makes this platform, I think, very powerful is its breadth. It spans a number of different topics, from core principles to advanced clinical concepts, and it brings together expertise that is really often scattered across specialties, or, as we know from textbooks, barely covered at all. And so this vestibular curriculum represents exactly what vestibular medicine and vestibular training needs to do. It needs to be collaborative, accessible, and international. So finally, I'd like to talk about a few ways that you can get involved. So there's many ways in which you can get involved. For the PROVIDE Doctoral Network, I would encourage you to check out our website and look at the activities that we're doing, and especially to check out some of the resources that we've posted on our Learning Hub. You can also talk to me more personally at our poster. And finally, we host network-wide training events every couple of months, and these are open also to members outside of the network. So if you have trainees who you think would benefit from some of these educational opportunities, please have them reach out to me. For the vestibular medicine curriculum organized by the Bárány Society, I would encourage you to consider joining the educational committee and having the opportunity to create or review new educational materials. And if nothing else, please just promote awareness of this initiative with your colleagues and trainees and check it out. And of course, you can always reach out to Raymond if you have any further questions about that. So thanks again for your time. I really appreciate your attention and also recognition that it's really a group effort that's going to be required to improve vestibular care through better, higher quality vestibular training. Thank you.